Hello. So today I'm with Simon Cartwright from the Whitehorse Medical Practice. Hi, Simon.
Hi, Sarah.
Thank you very much for joining us because I know you must be extremely busy and obviously working a bank holiday as well today. Can you give us, first of all, a quick rundown as to how long you've been in Faringdon working?
Yes, I've been a GP in Faringdon now for just over 27 years. I joined the practice in 1993 when the world was a very different place. 1% of the population had access to the internet in those days. And now look at us speaking on video remotely. Amazing.
Absolutely. And this is something that I've learned in the last 2 weeks, actually. It's a new thing for me, but it's working pretty well so far. So really appreciate your spending some time with me this afternoon, Simon. So let's get straight into the core of what we're here to talk about today. You know, we're in very unusual times, and assuming this is the first time you've seen anything on this scale in your career, how is the practice coping?
You're absolutely right, Sarah. We've never seen anything like this in practice in Faringdon. I think the most exciting thing we've had in the last 27 years is some flooding. In comparison, this is completely off the Richter scale. It's stretching us to the absolute limits here. Partly not because of lots of patients coming in. In fact, we're doing our best to persuade people to try not to come into the surgery, but because whenever we do see anybody, particularly if they have a temperature or a cough, we're having to wear full protection to protect ourselves from coronavirus. And likewise, if we're seeing patients who are at all vulnerable, we're having to wear all the protective clothing and protect the patient in order to prevent transmission of the disease to them if we might be carrying it. And of course, we're at high risk for carrying it because we're seeing a lot of patients fairly close up. We're doing intimate things like examining throats, taking blood. It's totally contrary to the government's advice about social distancing, but it's the only way we can do our job. Yeah. And so actually seeing a patient takes probably more like 45 minutes rather than the usual 10 minutes. So yes, yeah, it's not from large numbers of patients coming in, but from the awkwardness of having to do it properly.
Absolutely. And I know one of your colleagues put out a request a week or two ago for help with clothing for people to make scrubs because you are having to change your clothes so frequently. How has that appeal gone?
That's been amazing. We were sent a small box of supplies by Public Health England when this all started. It was basically a single carton of plastic aprons, disposable plastic aprons, some paper surgical face masks, and a box of gloves, which, to be honest, we already had. None of us were happy about doing close-up things with COVID patients wearing such minimal kit, but it was what we were told was the appropriate kit. We put out an appeal to people who had offered to help, and we've been overwhelmed by the response. We've had people on their sewing machines making scrubs like these, which we can wash at the end of every day, have laundered, and put a clean set on afterwards. We've been given the proper standard of masks, such as this one. Yeah. These were donated by Screwfix, free of charge. We've had people who are welders and solderers who have just given us their spare masks. They're obviously not working at the moment because they can't come into contact with people. Yeah. And it's been very touching, actually. Yeah. One of the other things that we've needed has been protective face visors, because as you can imagine, this only covers a certain part of you. If you don't wear glasses, or even if you do, there's still this part of the face unprotected, and the virus can be transmitted by splashes onto the face or into the eyes. Yeah. And so we put out an appeal for protective faceware, and these have been made. These are amazing. This black plastic part has been made on a 3D printer, and some local people who've got 3D printers have downloaded the pattern for this and have printed us dozens of these. The clear bit are old overhead projector acetates.
Yeah. Those
There's not much call for those now that we all have the thing on the computer, but actually that does the trick.
Fantastic. I actually interviewed Raoul van Eindhoven this morning, and he was wearing one in his interview as well. So we're going to be putting that out for people to understand the whole method of how he makes them, and some of his friends and colleagues locally as well. So,
I look forward to seeing that.
Yeah. So do you still need help from the community?
Yes, we do. We have a limited supply of these. If anybody can make more, we need them, but particularly the nursing homes need them. The nursing homes have only been supplied with the same basic personal protective equipment that we were originally given. They haven't got proper face protection either. And actually, there have been a lot of coronavirus deaths in the nursing homes. Very, very difficult for the staff there to deal with people who perhaps have dementia, don't understand the need to be isolated within their room. They wander a lot anyway. They can be argumentative if they're restrained. So it's a very, very tough job for the carers in the nursing homes.
Yeah.
And if they could get access to the proper protective kit, it would be an absolute boon.
Yeah. And do you think they need scrubs as well? Is that something that you've heard that they need, or?
They do.
Yeah.
They wear uniform, but they're only issued with the plastic aprons.
Yeah.
If anybody knows how to get hold of long sleeve aprons, that would be great. We don't have those either at the moment. We have the lovely scrubs. We're very grateful for those.
Yeah.
But between here and here, where the glove starts, we're completely exposed.
Yeah, no protection there at all. So, and in the practice, have you got enough scrubs, or are they're still presumably arriving with you? Are they every day?
They're still arriving. People are using amazing bits of fabric to make them as well. We've seen some of the doctors walking around in floral scrubs, very fetching. But really, who cares? You know, they're just as protective as the plain ones.
Yeah, and actually, hopefully, that puts a smile on some people's faces too, because you must have a few scared patients coming in to see you at the moment. So
I think so. They're scared because of the disease, and I think once you're wearing all of this, it's pretty intimidating. Yeah.
Indeed. So what advice, Simon, can you give us as to how to stay fit and stay well? What advice would you give out to the people of Faringdon?
Well, I think the government advice is quite right. You do need to stay separate from other people as much as you can. 2 meters is considered to be an appropriate distance. I think as a rule of thumb, one needs to just carry in the head that if you consider everybody to have coronavirus, then you can't go wrong. Yeah. Even if it's your best mate, if you've been invited to, you bump into somebody, you want to stop and have a chat, just think, they could have coronavirus, and I don't want to get coronavirus. I'm going to keep my distance.
Yeah, that's sound advice. Thank you. And something that's just sprung into my mind, I know in the hospitals, the medical staff are struggling to get time to eat properly during their shifts. Is that something that's a problem for you at the practice as well?
No, it isn't. We have quite a lot of staff here. Not everybody's busy seeing patients. So, and fortunately where we are, we're within walking distance of at least 3 supermarkets and a petrol station. So, and they're reasonably well stocked. There's a bit of a queue when you get there, but no, we can get access to food. Thank you.
Good, excellent, lovely. That's great. Well, I don't want to take up too much of your important time. I know how busy you are and just how stressful this time is at the moment. But can I, on behalf of Faringdon, say thank you to you and your colleagues for everything that you're doing. We obviously hope that you stay safe and you stay well, and your families as well. And if there is anything else that you think of that as a community we can do to help you, please let us know. And no doubt the troops will rally.
Okay, thank you very much for all your help so far.
You're very welcome.